The following video presents some common post-surgical guidelines for someone with your condition, but the doctors and medical staff will provide you with specific directions for your personal situation. When it comes to recovery, you play a big role in your healing. By following your specific medical instructions, you will better ensure a good recovery. On the other hand, not following the medical directions given to you may impair your recuperation. We're committed to your successful recovery and want to assure you that we are here and available even after you go home. To make sure everything is going well, someone from the Surgery Center will call you within 24 hours to learn how you're doing. If you're having any problems or need information or assistance, don't hesitate to call our doctor's office. Either your doctor or one of the physician partners is always available. You will most likely be prescribed an antibiotic drug. These medications are very important to take on time until they run out as prescribed, usually with some food. Antibiotic drugs help prevent your surgical site from possible infection that would impair your recovery. You will also be prescribed some pain medicine. If you choose not to take the pain medicine when you have pain, you may add to your recovery time. Your pain is usually strongest the first day after surgery and may then taper off. Likewise, you should find that you need the pain medicine less and less as time passes. It's best to take your pain medicine with food and only as long as you believe you need it. If you find that your pain is not decreasing after 1 week, please discuss this with your doctor at your first post-op visit. We're now going to present some information about your specific procedure. Carpal tunnel release. Carpal tunnel syndrome is a term that is often used incorrectly. Many people, as well as the press, will call any wrist or hand ailment carpal tunnel syndrome. This is wrong. The carpal tunnel is a specific physical space at the wrist. Within the carpal tunnel run 9 tendons, 2 to each finger and 1 to the thumb, as well as the median nerve. Carpal tunnel syndrome is a very specific condition in which the contents of the carpal tunnel become too large for the fixed space, putting pressure on the nerve. When the pressure becomes great enough, the nerve stops working normally, and the individual develops some numbness, tingling, and pain in the hand and fingers. There are many causes of carpal tunnel syndrome. The most common causes of carpal tunnel syndrome are repetitive activity and the normal aging process. Other causes include fractures, arthritis, fluid retention during pregnancy, and metabolic diseases such as thyroid conditions and rheumatoid arthritis. In many cases, carpal tunnel syndrome is caused by a combination of one or more of these factors. In more severe cases of carpal tunnel syndrome, surgery is often the best option. The goal of all carpal tunnel surgery is to take pressure off the nerve by making more space within the carpal tunnel. After surgery, a splint is applied to the wrist for approximately 1 week. There is generally tenderness in the palm at the levels where the transverse carpal ligament attaches to the bone, not directly at the site of the incision. This will often last for several weeks or months. While this doesn't stop the individual from using the hand, it may take several months to regain full grip strength. In many cases, any numbness and tingling will disappear very quickly. Generally, night pain disappears immediately. In some more advanced cases, it may take longer for numbness in the hand to go away. Your surgeon most likely injected your surgical incision with a long-acting local anesthetic at the time of surgery. This is to decrease postoperative pain. As a result of this injection, you may have numbness in the hand for up to 24 hours. Keep your hand elevated above the level of your heart or higher during the first 2 to 3 days after surgery, as this will reduce pain and swelling by keeping your blood flow to the surgical site at the best level. Proper blood flow also advances healing to the site. Please keep your dressing dry and clean from dirt, grease, oils, or any liquids until your next doctor's appointment, or as directed by the medical team after your surgery. Keeping your dressing dry and clean further prevents possible infection which may delay your full recovery. Please cover your dressing in a secured plastic bag if you desire to shower or bathe. It's important that no water reaches the dressing. You're encouraged to move your fingers immediately, but avoid heavy lifting with your affected hand, even with a small grocery bag or child. Do not carry anything over 5 pounds using your repaired hand until the doctor sees you in follow-up. Finally, remember to take your antibiotic medicine on time until you've used them all, and take your pain medicine as needed. Thanks, and we wish you a speedy recovery.